Welcome to the Senior Rehab Podcast,
the podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello, friends. Welcome to the Senior Rehab Podcast. Thank you for taking the time to listen to this episode. This is a post by yours truly. It was written in July of 2015, titled, Dear Future Physician. I was recently asked by Dr. Mark Cucuzella, who's a previous Senior Rehab Podcast guest, to provide his medical students with some insight from my experience as a PT working with the elderly. I would now say older adults. The following is my response. Dear future physicians, I'm writing you to offer some observations that I hope to be helpful for you in caring for people. I'm a physical therapist who works with adults who are homebound. PTs help people be as mobile, functional, and independent as they can be. There are many factors that can limit patients' abilities, and it is our job, along with yours, to figure these out and provide ways to optimize their abilities and their participation in meaningful life activities. This is not an easy task, especially from the medical standpoint. I've seen what your life is like secondhand. My wife is an emergency medicine physician. I've been alongside her at every step of her career. I recognize that being a physician is very challenging. People aren't getting any healthier. Dr. Google knows way more than you do, and patient gratitude can seem like something of the distant past. Yet, I want you to know that your work still matters. As a PT, I often interact with patients right after physician visits. This is a unique perspective as I get to see how interventions, bedside manner, and education impact patients. Now, I've only been practicing since 2011, but I can confidently say that physicians still have a tremendous amount of influence in patients' lives. Some people still trust doctors and do what they recommend. I know it sounds crazy given your experiences in the hospital or clinic, but some, if not most patients, really do trust you. Nearly every day, I make recommendations to my patients, and by far the most common response is, well, my doctor said, ... Physicians are able to influence patients exponentially more than most other healthcare providers. I know there are exceptions to this and differences among generations, yet I don't want you to lose sight of your power. With great power comes great responsibility. Quote from Benjamin Parker in Spider-Man. Your responsibility, and mine, is to number 1, assess patients, number 2, identify dysfunction or disease, and number 3, negotiate an action plan for ongoing care. The third role is often the toughest, one for all types of clicians. How do we develop an action plan that is simple, understandable, effective, and empowering? I feel this is a big reason why figures such as Dr. Oz, Mark Sisson, Rob Wolf, etc., are building such massive audiences. Regardless of what you think about their health philosophy, these public figures are providing something that people are seeking. You, future physician, can do the same. Physicians often have to give bad news, diagnoses with diabetes, lung cancer, or osteoarthritis. However, with the bad news can come good news. With almost any condition, patients can and should be empowered to take charge and be proactive about their situation. I will go through a couple scenarios that PTs often encounter when patients are not empowered, with a discussion and recommendations after each. Scenario 1. In quotations, I can't do that because I was told 23 years ago that I had fill in the blank of whatever degenerative condition, says Frank. People need to hear how their body works and how it can recover in a clear and concise manner. Frank's statement is very common to PTs, as many of our patients have been given a diagnosis through imaging that was perceived as a death sentence. And there lies the problem. Frank's perception of his back may be more debilitating than his back itself. Based on interactions with Frank, one could be led to assume Frank does not believe that the pain he's experiencing is complex and is more than just damaged structures and or tissues linked to why things hurt. His MRI doesn't necessarily indicate what's causing his pain. There's a link to you are not your MRI. And then he can reduce his pain and regain function despite his positive findings on the MRI. Frank's response screams thought virus. The thought virus or viruses that's infiltrated Frank's mind will more than likely limit his potential to recover. Action point: stop thought viruses. People's beliefs or ideas have a tangible impact on the human experience. This is being demonstrated in current pain research as people's pain levels and physical performance have improved through neurophysiology education. Our thoughts and beliefs matter and shape our experience. The following is a quote from last week's Senior Rehab Shorts author, Ursa Religioso. Pain is the vehicle that brings most people to the clinic. We need to give meaning to the individual's meaning about their pain that they have already created. Bringing their thinking into alignment with what we really know about pain, we must convey the right message from the start to reduce the risk of chronicity. Our beliefs commonly come from people in positions of authority. Dr. Oz and Dr. Google have high authority in forming people's beliefs about their body, but so do you, future physician. What a PT tries to drill into someone's head for months, you can convince them of in seconds. I encourage you to learn how to explain pain to your patients, and I put a link to that amazing book, Explain Pain. You can prevent thought viruses and empower people to take charge and do something about their health. That's if lifestyle modifications are effective given their diagnosis. Empowering education is key, yet you probably won't have time to explain proper nutrition, how they can modify their activities to reduce their pain, and effect of sleep on insulin sensitivity. That's why you should develop a network of professionals you know, trust, and believe in. Not all PTs, chiropractors, personal trainers, nutritionists, etc. are the same. Refer to these professionals and ensure that the patient knows you believe in that professional. There's a big difference between, I'm going to give you a referral for PT to see if we can help out with your back pain, and I'm going to send you to John Doe PT. He has a great track record of helping people out with your issue and will be a tremendous service to you. The latter statement already sets the patient's positive expectations, which can help their outcomes. Scenario 2. I've fallen 3 times in the past week. I'm just losing it, says Betty. Aging is inevitable, yet each individual can have great influence in how he or she ages. Osteoporosis, sarcopenia, frailty syndrome, and frequent falls may be minimized with prevention, yet patients must believe that they can and know how to age gracefully. I believe the healthcare system has done a great job in emphasizing active lifestyle to minimize the effects of aging. Millions of people exercise regularly in some way, shape, or another, yet many people focus on the quantity of activity rather than the quality of activity, and they do not move in a way that actually stimulates positive adaptation. Walking and seated soup can exercises will only get them so far. Action point. Emphasize quality movement and exercise. Quality before quantity should be our aim. There are definitely exceptions to this. For the most part, people need to move well before they move often. As movement quality increases, movement quantity and load should increase. Here's what physicians can do to encourage their patients to age gracefully. Emphasize the need for a movement practice. There's a huge difference in practicing movement and working out. The former typically focuses on quality and the latter focuses on the burn. Refer to a trusted, experienced professional that knows how to get people moving well. A referral to a trusted PT for development of a personalized exercise program would be a great start. Other alternatives may also be helpful. MoveNet, barbell training, kettlebell training, Tai Chi, yoga, etc. But be sure to ensure that the instructor is experienced in working with older adult clients before you refer. Emphasize the benefits of lifting heavy things. Lifting heavy things with good technique can be one of the best things we can do as we age. Encourage patients to move their joints through their full range of motion daily. I like to tell my patients to make a point to go from standing to their belly and back up to standing at least once a day. A get up a day keeps the doctor away. Discuss footwear. The quickest way to help someone improve performance can sometimes just be a change of footwear. Some people need corrective shoes and orthotics to help with their specific deficits, but thick, squishy, high-heeled shoes should not be the norm. If no major deficits are present, shoes should provide protection but also allow for perception. The inability to perceive and sense the ground with our feet has a direct impact on our performance. This is key for older adults as they often spend much of their time in shoes that negatively impact their performance. Recommend wide toe boxes, limited slope from the back to the front, flexible sole, and a little bit of cushion. The degree of slope and the flexibility of the sole and the amount of cushion will depend on the patient. It is best to refer to a knowledgeable professional to assess them on what would be appropriate. In conclusion, thank you, future physician, for what you do. You have invested a tremendous amount into your career and others' people's lives. I hope you don't lose sight of the tremendous influence you have on your patients or of the importance of interprofessional teams to support your patients' health. It's interesting to read this article after, it's been about a year since I first wrote it. And, thinking about the previous senior rehab shorts that Ursa Religioso did, the 5 questions you should ask yourself regularly, there are definitely some things in this post that I don't agree with anymore. But, I wrote it, I put it out there. Hope you enjoy. And I challenge you to think about your perception of how you think about things, your clinical reasoning, and what you believe. And is it actually true? Hit me. I want to thank you for listening to this podcast. The show notes and much, much more can be found at seniorrehabproject.com. I want to encourage you to go there so you can join me and many others in the movement that's changing the face of geriatric rehab. Just go to seniorrehabproject.com, click join, and you'll be able to get access to our private Facebook group, which can basically serve as your virtual mastermind group. You'll get a short and sweet monthly email from me with useful links for you and your patients. And lastly, you'll get 10% off your first purchase from the Senior Rehab store. So all of this can be found at seniorrehabproject.com. And until next time, my friends, do not forget to stay funky.